Did you know that many people ignore subtle signs that could indicate an impending heart attack? And the worst part? When they realize it, it could be too late. Heart disease is one of the leading causes of death worldwide, and understanding the hidden signs could literally save your life. In this video, we will reveal 5 signs that you might be one step away from a heart attack and have no idea. This is the first episode of a special series about heart health. So, be sure to subscribe to the channel and hit the notification bell so you don't miss the upcoming episodes. Also, in the first comment of this video, I will leave important links with scientific studies and medical articles for anyone who wants to dive deeper into the topic. Now let's dive into the first sign. Sign 1. High blood pressure without symptoms. High blood pressure, also known as silent hypertension, is one of the biggest indicators of heart attack risk. But the problem is that many people don't feel anything at all. You could have high blood pressure right now and not have any obvious symptoms. Just as we discussed, hypertension can be silent and deadly. A notable example is Bob Harper. Known as a trainer on the TV show The Biggest Loser, Bob Harper suffered a near-fatal heart attack in 2017 at the age of 51. He was at a gym when he suddenly collapsed. Fortunately, he received immediate medical attention and survived. After the incident, Harper became an active advocate for heart health awareness, sharing his experience to warn about the risks, even for seemingly healthy individuals. According to a study published by the American College of Cardiology, about 46% of adults in the United States suffer from high blood pressure, and many don't even know it. The danger lies in the fact that hypertension forces the heart to work harder, wearing down its walls and increasing the risk of a sudden heart attack. A study led by Dr. Hiroshi Yatsuya from Nagoya University in Japan analyzed over 12,000 patients and concluded that high blood pressure doubles the risk of a heart attack, even without noticeable symptoms. Remember, all the links to the studies mentioned will be available for consultation in the first comment. Did you enjoy the content so far? Then leave a like to help the channel, and comment below if you've measured your blood pressure recently. And now, you will discover how to identify the other 4 warning signs, with surprising symptoms that no one associates with heart problems, but that could be a red alert. Sign 2. Persistent cough. If you have a cough that won't go away, you might think it's just a cold or an allergy. But what if I told you that this cough could be a hidden sign of heart failure? A persistent cough, especially when accompanied by wheezing or pink-tinged mucus, can indicate that the heart is not pumping blood efficiently, leading to a buildup of fluid in the lungs. This buildup causes irritation, resulting in coughing episodes that many ignore. An example that persistent cough can be a sign of heart failure is filmmaker and actor Kevin Smith, who suffered a massive heart attack in 2018 at the age of 47 after a stand-up performance. He was diagnosed with an almost complete blockage of the left anterior descending artery, known as the widowmaker. Smith survived and later adopted a healthier lifestyle, including significant weight loss and dietary changes. A study published by the American Heart Association, conducted by Dr. Clyde Yancey from Northwestern University in the US, suggests that congestive heart failure can lead to respiratory symptoms even before any chest pain appears. Another study from Imperial College London in the United Kingdom analyzed over 28,000 patients and found that the presence of chronic cough in individuals with a history of hypertension could be one of the first signs of developing heart failure. Sign 3. Memory failures or signs of dementia. Now you might be wondering, what does memory have to do with the heart? The answer may surprise you. The brain requires a constant flow of oxygen and nutrients, which are transported by the blood. When the heart is not functioning properly, the amount of blood reaching the brain decreases, impairing cognitive functions such as memory, reasoning, and concentration. Studies from Harvard Medical School, led by Dr. Alexandra Gonçalves, reveal that patients with heart failure have up to a 60% higher risk of developing early-onset dementia symptoms. Additionally, research from the University of Toronto, Canada, showed that cardiovascular problems are directly linked to neurodegenerative diseases such as Alzheimer's. This happens because inadequate blood flow can lead to the death of brain cells over time. So, did you expect that coughing and memory lapses could be related to heart problems? Leave your comment below. Sign 4. Low urine production. Have you noticed that you're urinating less than usual even though you're drinking plenty of water? This could be a hidden sign that your heart isn't functioning as it should. When the heart struggles to pump blood effectively, the kidneys receive less blood flow. As a result, they reduce urine production, leading to fluid buildup in the body. This process can cause swelling in the ankles, feet, and even the abdomen. But many people ignore this sign, thinking it's just common water retention. According to a study published by the National Kidney Foundation, led by Dr. Joseph Vasilati, from the United States, there is a direct relationship between heart failure and decreased kidney function. Another study conducted by the University of Sydney, Australia, revealed that patients who experience a sudden reduction in urine output have a 40% higher chance of suffering a heart attack in the coming months. Sign 5. Difficulty breathing. When lying down or waking up breathless at night. If you've ever felt short of breath when lying down or woke up in the middle of the night gasping for air, pay attention. This could be one of the most severe signs of advanced heart disease. This happens because when the heart isn't pumping blood properly, fluid can accumulate in the lungs, making breathing difficult. This symptom is known as orthopnea, when shortness of breath occurs when lying down, or paroxysmal nocturnal dyspnea, when a person wakes up suddenly with difficulty breathing. Symptoms such as difficulty breathing when lying down can be warning signs, as was the case with comedian and TV host Rosie O'Donnell, who suffered a heart attack in 2012 at the age of 50. She experienced symptoms like chest pain and nausea after helping a woman out of a car. Initially, she ignored the signs, but later sought medical attention and discovered that one of her arteries was 99% blocked. Since then, O'Donnell has been a vocal advocate for raising awareness about heart attack symptoms, especially in women. A study from Johns Hopkins Medicine, conducted by Dr. Roger Blumenthal, revealed that patients who suffer from these nocturnal episodes have up to a 70% higher risk of developing heart failure in the coming years. Furthermore, a study from the Karolinska Institute in Sweden discovered that breathing difficulties during sleep are often associated with plaque buildup in the coronary arteries, significantly increasing the risk of a heart attack. Now that you know the 5 hidden signs of a heart attack, it's essential to stay alert to your body. If you've identified any of these symptoms in yourself or someone close to you, seek medical attention immediately. But hold on, it's not over yet. This was just the first video of a special series on heart health. In the next episode, we will reveal the foods that could be destroying your arteries and putting your heart at risk without you even realizing it. So, subscribe to the channel, turn on the notification bell, and leave a like to make sure you don't miss the upcoming content. And remember, in the first comment of this video, I've left important links for you to dive deeper into the topic with medical and scientific sources. See you in the next episode.